So just if I were to,
That is not
I
your
don't care
choice.
how you want to say it, examine it. Now, what I'm going to do is I'm going to come into snugs because that's just the easiest way to show versus sitting off the side of the chair. So, what's with so? Why can't it drop so? Seriously? When you're just looking at someone sitting, you can do a visual exam. To me, that's just like looking at a baby, not being able to separate the eyes from head function. To do a visual exam on somebody is very low function. I can go through them all. I can tell you what's wrong with every darn person in there. I get it. That's not my job. But to sit there and actually work with someone now in sitting and then doing a functional exam. So same thing. Now obviously my hands are a little bit wider because I'm not working on a little baby, but it's the same principle. So all I'm going to do is just to see how she reacts in sitting and her feet. I'm just going to rotate and tilt her over to her left side. Now here, if her head were to shorten, her neck were to startle, any of that, now feel the different. I can't even get her to her right side. You feel that? So now, I don't have your head on the video, I'm only doing your body, but just for your purposes, I want you to look up at the corner of the ceiling and come back down. No, to the other way, towards the left. And come back down. Now, I'm going to just bring it over to your right. I'm going to push it. Now look up to the ceiling and come down. To the right side. Just look to the corner of the ceiling. Do you feel a difference? Here, look over up to the corner. Versus here. Do you see it? Do you feel it? Do you see it? Can you see it?
It's different.
It's different. Now
This
again,
side is more fluid.
right,
This side, it's like,
right. So, right off the bat, I can say she would do better on the right side of the room, looking up over, because she'll be able to look up and react. Versus if you put her on the left side of the room, let's say, especially if the door was on that side, she would be more inclined to go and see what's going on with the door and stuff than attain to the classroom, because see, I can't rotate her to the right. Do you feel that? See? Versus here.
oh, but you know how like teachers will sit kids in rows starting with the alphabet? I wonder if you looked at where people's last names were, if you would see a trend to one side or the other. Just because that's, you know, kind of how teachers will do it.
I think
frequently.
this also, the back organization goes back to the crib. She probably had the crib on the right side wall, so her brain and her head naturally, like when mom came into the room or the door opened, she went, oh, you know, on that side of the crib. Versus the crib being against the left side of the wall, you know what I mean? As a baby, she's not setting up these patterns. But that might be too hoity-toity, I don't know.
I'd flip her.
But in general, if you put a child down on a crib, you should put them down to the left side as well as the right side. But since most people are right-handed, what am I going to do? I'm going to place her down this way, down to a crib versus this, you know, depending on. But again, it also depends to where the crib is.
We flip it. Her. I put her.
So here, now ready, now for that we've done all that, look at the, feel the difference.
Be fair.
And this is walking right here. So now what I would like you to do is sit on the corner and just feel first if that's any different. See, now feel how much quicker you are over here. Do you see the quickness? Also notice how I can tilt your back and how the head still reflects that it's up. See? Head up, so that you don't have the wobble here. This is where too you're going to see this with a lot of kids, because the head tilts back, the pelvis tilts back, and now the head's here. So in this position, even if, I'm gonna restrain your head now, look up. See, this is what's going on with that little girl that you were talking about. So now what I'm gonna ask you to do is turn around so your feet are on the table. No, put your bum here, like Arlie was sitting. So the feet are, yes. Okay. So now in this position, I want you to feel, see how restricted you are into coming up. So now I want you to bend the knees out a little bit, please. See already the difference, how that, see also too, how your availability, and also look how you went for a protective response immediately, like you're set up for it. So now I want you to crisscross applesauce, fold the legs. So now look at the availability that you have in your pelvis.
So have a child in a crisscross applesauce?
Is much more effective if they can do it. See, with me, because of my issues, I wouldn't have done well, because also put your knees up like that. See how your back comes back? And see here, it's not the same thing. So that's where too, I really appreciate it in karate. You tell all these little kids to do a center punch. No two kids are doing a center punch the same way. They have a different horizon setting, they have a different feel for the arm, they have a different feel for their back, they have a different feel with how they're standing, they have a different feel with what a punch is. It could be an articulation of a vocabulary, what they understand a punch is. They could be copying the kid that's doing it completely wrong, and that's their role model. To evaluate it that it's always the teacher's issue, you know what I mean, or whoever's articulating the commands or the instructions, is really, you have to know with whom you're dealing with, but in my mind, that's physically. Like if someone comes in here and they can hardly breathe, their hands are very constricted or splayed, I know what kind of response they're going to give me. They're not going to be as open-minded. They're not going to be as, just like they say, like in court cases, you don't want someone that folds their arms a lot because they're being aloof, or, there's quote body language. I'm looking for bone language. But yes, in general, you could say for most of the children, crisscross or folding the legs is the most advantageous. Also too, look at how they're at attention. So they're much more visually attentive in this position. Let's say put your legs out straight again. So see here how you're working so hard to be in your body. How do you pay attention to the teacher? Now that being said, you still might be working with a child that has hip dysplasia and all of this that cannot do crisscross. But those are the times that you want to look at something different. Now this is where I really wish I had one of those stupid boppy chairs, or what are they called?
Those boppy pillows?
No, those stupid chairs that restrict the pelvis.
Oh, bumbo.
Bumbos, yeah. She should, because she's but I wish I could put an adult in a bumbo and shows what it does to a system.
She just goes. You lean back when Mama moves her feet. I'm sorry. That's what she does in the bumbo though. She flails back. I'm sorry. What's more? No.
I can't. See, this is perfect. I can't cry and eat at the same time. It's two different functions with my mouth.
Yeah, I know that's the goal. Eat instead of crying.
So back to folding your legs.
I'm sorry.
So with what I was doing, I'm just coming here, like I said, it's just a slight, feel how that nice rotation. Now I want you to feel the difference. This is pushing forward. Side to side. Okay, now I'm going to rotate forward. Feel the difference? Now I'm going to rotate to your side. Feel the difference? So I'm going to rotate backwards. But I think you'd be very surprised before you, quote, decide you're going to do ABA, if you do these kind of little movements, what it would do to the level of attention of the system that that child can give you. So now here what I was doing was, remember when I was rotating my left hand back, and I'm just working on the rib cage. See how that allows the diaphragm to work in a higher function? Guess what happens when kids take tests? Most of them choke. When they choke, this is why, right here. Now, let's say if you were teaching a cognitive class, or that can talk through it, have everyone sit there. Tell them to, don't say tilt your pelvis. They don't know what the pelvis is. You can eventually teach them. Just say, okay, like what I'm going to do for you. Okay, now slouch back. Okay? And now, think of the spot in your back right here, and as if I was, and now, quote, sit up straight. And now as if I had a string, slouch back, and then sit up straight. Or come to sitting, but again, you're talking like, say, to like third graders. So even if you couldn't get around to your 30 kids, that's something you can do with all of them. And then what I would do next then is this time when you round your back, I want you to put your knee into the corner of your leg. No, don't bring the leg up. Just think of your elbow. Here. So slouch back. And just think of where your elbow is. To there. And now sit up. And again, think of your right elbow. And now do it to your left side. There you go. Again, just to learn where their bodies are in slouching. And now put your hands on your knees. And now keeping your hands on your knees, slouch back and see, there you go. And just elongate those arms and then come back up. And this will help them with a sense of proportion with their arms and stuff, with writing and all of those kind of things. But anyway, the main concentrations on each one of us working on each other right now is just on feeling what it's like in different variations of sitting. So I'm going to ask you to just come a little bit forward, actually, because I want your feet. Yeah, touch the floor. So again, I'm just showing you how to, in a sense, do an examination. So I'm going to just go over to your left side. And that's non-existent. Tad more on the right, but not much. So what I'm going to do differently on you is feel going back to the left side. Now that's easier. And back to the right side. It's not as easy. Feel how you're gripping the muscles here? So with that now, I'm just allowing you to feel, there you go. See how you're starting to feel going over. Now since this is new to you, I let you go to here and breathe. Because you're not used to breathing and being over your pelvis. There you go. See how that's getting easier? So notice I'm doing it a little bit different every time. Now I'm not saying you're going to sit in classroom and do this, but if your pencil drops,
How am I supposed to get it?
yeah. So if I suddenly said, go get your pencil, look at that. See, getting your pencil over here, you'd have to either fall out of your chair or get up and get the pencil because...
Funny, I used to fall out of my chair a
No,
lot in school.
Well, that's why. Feel the difference already? And feel the difference. Yeah, but that's where people are like, pay attention. You know what I mean? Or don't do that. I think, Now, do some kids learn that they fall out of their chair, everyone laughs, so they become the classroom clowns? Absolutely.
I fall out of their chair and wish they didn't.
But yes, most kids, you know. There you go. See too how you're getting quicker? And you're also getting a nice little ducktail. So now I'm going to work on the right side. Again, notice I can't, see this got quicker and this got quicker. But I know darn well I can't suddenly go, you know, see now the head's falling forward.
Yeah.
That's where I have to slow down. Now to do this lesson properly on you, because I know your history, I honestly have to mess with your ankle at the same time.
Oh, what? I hate you.
Because see, it's the lack of ankle rotation that's restricting all of us. Like here, I'm just gonna, okay, now take your right foot and just do a circle it around with me. So just that little bit, stop the foot. Yeah, look at the difference. Just coming back and seeing if that's any different. Okay, now cross or put the legs over the corner of the chair and see what the difference is there. See how much more available the pelvis is? You can do complete circles. I think I thought of new chairs now for preschools for kids with disabilities.
On a triangle?
Yeah.
It'd be easy to do a triangle chair instead of a flat back to it. Instead of a square.
Well, you do the square and just cut it short here in the back and put the back onto it.
I saw a teacher had the child sitting in a chair backwards, so that
Yeah.
But that would really restrict their upper mobility.
with the back.
Not
of the
only
chair
that, but if you notice when I touch someone, and this is where I'm not like, okay, Jenna, with my hands here, getting her to do something. I'm not visually ever in her plane, nor am I with children. Or do I go like something like this? Maybe in very special, but it's like dressing a child. At some point, she has to realize that I'm not a part of the equation of putting the clothes on. It's a very hard separation to do as a mom with special needs because it takes so long for a kid to self-dress. But you need to allow at some point that transition to happen. Don't do it on a day of an important event where you have to get ready in a half hour. Do it on days that you can, you can get your hand in there. You can get, because the more I'm involved visually in her plane, or the chair is visually in this child's plane, the more the mind's going to be, yeah, I can sit up as long as that's there. I don't ever, and this is the hardest part I have about doing my videos, I don't want people to go, okay, where did Michelle put that hand? I didn't put my hand specifically here. I've not studied anatomy to that point. With Jenna, it might just naturally go here. With Ed, it might be here. With Adam, it might be here. I don't know. It's not about X marks the spot. It's always about efficiency of movement. But you can see how much nicer, as the pelvis opens up, how a child can sit. And with that, I'm going to get out of the way. And I'm going to have you sit with your back to me and your legs long on the table. And then I just want to check to make sure that that's on camera.
It's really hard to keep my knees don't go straight.
Oh, I know. And look at the pressure it puts on the back.
Yeah.
That's what I'm saying too, when people don't understand movement and they expect, especially children, to be in positions that it's just not functional.
My knees just don't go straight.
But I can't bring you over your pelvis,
No.
period, yet. So just bend your knees a little bit out. So you're ready, the difference.
Yeah.
And I can start, now it's not functional, the head still wants to come forward here. I don't know because you're wearing jeans and stuff, but can you do a, fold your legs? So again, now in this position, see now you're available.
That
Totally,
was me.
yeah.
That was me.
most people it's going to be in this position, but again, if you have hip dysplasia, cerebral palsy, all of this isn't something, because the way the hips have started to form due to prolonged laying. What people don't understand, and which I believe in, if a child's left laying too long in a certain position, changes the bone density, and I think that's where you get a lot of hip dysplasia. Because the pelvis is allowed to expand out, let's say, whereas the bone that has been left lying has a much denser. So already it's going to change the way the gravity affects them. And then what really starts to happen, but this is prolonged cases, is a chest cavity will start to collapse or indent. So it'll change the oval, which also will change diaphragm and all the organ function, because the chest cavity is starting to become way too flat. Mm-hmm. And the chest cavity starts to indent in. Mm-hmm. So in here, I'm just doing that light rotation into the ribs. So what do you think?
Makes sense. Especially about kids in school, that makes so much sense.